Last month, I outlined a pathway together with my National Cabinet colleagues, a pathway that would take us to where we want to go. Tonight we've agreed, in principle, the plan that will get us there and the targets that will get us there.
The plan, endorsed by National Cabinet in early August last year, was not really a comprehensive strategy for how the nation would live with COVID-19, as much as a roadmap for removing restrictions as more Australians became vaccinated.
70% to get to the next phase and 80% to phase C.
This was at a time when the Delta variant had a deadly grip on New South Wales and Victoria. Many states were in lockdown or living behind closed borders, and the focus was on getting as many people vaccinated by the end of year as possible. The plan, as it was spelt out by the PM, was to get from pre-vaccination settings, focused on continued suppression of community transmission, to post-vaccination settings, focused on prevention of serious levels of illness, hospitalisation and death.
Today, we fully agreed the national plan that I outlined to you last Friday, the national plan, that pathway that takes us to the position where we live with this virus. And we live with the virus where we ultimately start saying goodbye to lockdowns once we reach 70% vaccination of the population, and then ultimately move away from them in the third phase, phase C.
This clearly did not anticipate the possibility that high levels of vaccine would not actually stop the virulent spread of new forms of the virus like Omicron, or at least it highlighted the fact we all tended to overlook about vaccines, that their great strength was in reducing deaths and serious illness, not stopping the virus altogether. National Cabinet's plan was famously based on modelling by the Doherty Institute of the likely impact on the health system of easing restrictions as vaccination rates rose and once high vaccine rates were achieved.
Something where there are no stay-at-home orders, there are some social distancing rules and the 2 square metre rule, there'll be caps on people in stadiums and workplaces and things like that.
Whatever the modelling said, it did not represent or inform a publicly available plan which showed what forward planning was being done to ensure Australia had contingencies in place on everything from PPE to vaccines to enough tests to COVID treatments, or for how the country might cope with scenarios like the rapid infection of millions of Australians that we have seen in the past month. For a while, the national obsession was with reaching vaccination targets after a slow start and responding to the impact of the Delta variant. As vaccination levels started reaching into the 80 and 90% zone, things were looking good for Christmas.
This Christmas we're about to have is a gift Australians have given to themselves.
But that clearly didn't go to plan, and we entered the new year with case numbers soaring and the test system collapsing, as the tracing system had before it. At the same August press conference where he heralded National Cabinet's endorsement of the plan for living with COVID, the PM started talking about rapid antigen tests.
We also had a very extensive discussion today on rapid antigen testing. It is an important tool to be used at the right stage of the process. And if you're doing voluntary rapid antigen testing at home and things of that nature, then the state health authorities won't know.
While the federal government brought tests to trial in areas such as nursing homes, there are few signs that government contemplated the possibility that it should try to secure a significant stockpile in the last months of 2021, despite urging from bodies including the AMA. In November, just weeks from Omicron arriving in Australia, National Cabinet was only just agreeing to health officials developing a nationally consistent framework for the use of rapid antigen testing. But by early in the new year, with case numbers exploding over the Christmas break, the need for the tests had become urgent, both because the PCR test-based testing hubs were being overwhelmed and because of the shortage of tests across the country. The issue became whether the tests should be free.
We're at another stage of this pandemic now where we just can't go round and make everything free.
And despite the fact the question of how to register RAT test results had been recognised as a crucial one, states and territories are only now scrambling to implement registration systems. The nationally consistent framework seems to have gone out the window. Then there is the question of who is responsible for ensuring supplies.
Why weren't more supplies of rapid antigen tests secured earlier, given the department had modelled scenarios in which a more contagious strain of the virus would place pressure on testing clinics?
Well, the Australian government did secure the testing supplies we needed for rapid antigen testing to deal with the Commonwealth responsibilities in aged care. The suggestion that somehow this responsibility shifted from the states to the Commonwealth is false. It was always a state responsibility.
But the federally run medical stockpile did buy a lot of materials for PCR testing early in the pandemic. And today, the PM opened the door to the federal government helping plug gaps with rapid tests beyond aged care, including in education and in critical small businesses.
Looking at potential future new strains, are you satisfied with the level of preparation and contingency planning that was done ahead of Omicron? And has the federal government stepped up in relation to what's occurred with Omicron, its future preparation and contingency planning for potential new variants?
Yes.
Lack of planning has been a constant criticism of the government during the pandemic, that it has been too late to respond to developments. Last year, the Audit Office reviewed purchases for the National Medical Stockpile, a reserve of supplies for use in a public health emergency. In the first 2 months of the pandemic, in 2020, Health was given more than $3 billion to purchase supplies. The auditor found that before the pandemic, there had been no documentation of any agreement with the states about stockpiling responsibilities. What's more, there were no specific procurement targets for personal protective gear and swabs. And in the case of COVID-19 tests, the Audit Office was unable to determine if the procurement target was met because there wasn't one. In September last year, the Senate COVID Committee tried to find out from the head of the Health Department what the implications for hospitals would be of removing restrictions under the National Plan.
How can you agree to the National Plan to transition from A to B to C and then to D without having line of sight on what it means for your hospitals?
We're finalising that work, and the premiers have been very clear that their support for the National Plan is conditional upon them being assured that they do have sufficient health system capacity.
Okay. Well, then how can the Prime Minister be pushing the National Plan if he doesn't know what the hospital capability is?
Well, he has seen high-level aggregated data, which we have provided.
Even 2 years into a pandemic, the planning processes for dealing with it still seem to be evolving.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.